Hello, my name is Sarah Boyd, and I'm the president and founder of Operation Truth Vaccination Exposure Research, a 501(c)(3 built to bring awareness to our vaccine injured patient demographic and the need for medical research so that we can find that critical diagnostic and treatment protocol to take care of all patients. The last few weeks, we have shared videos of how autonomic neuropathy, Raynaud's phenomenon, lymphedema, and endometriosis presented throughout my body. How I was able to successfully present my root cause analysis to the lead medical researchers to determine my cause to be from a vaccine injury. This week, we're discussing thyroid nodules and how they can cause thyroid diseases like hypothyroidism and hyperthyroidism. According to the Cleveland Clinic, a thyroid nodule is an unusual lump or growth of cells on your thyroid gland. Your thyroid gland is a small butterfly-shaped endocrine gland located in your neck below your Adam's apple. It produces the hormones thyroxine, also called T4, and triiodothyronine, also called T3. These hormones play a role in certain bodily functions, including metabolism, body temperature, mood, and excitability, pulse and heart rate, and digestion. More than 90% of detected nodules in adults are noncancerous or benign, but they may represent thyroid cancer in approximately 4 to 6% of cases. Even though most thyroid nodules are cancer, they can sometimes be a sign of and/or cause thyroid disease. Anyone can have a thyroid nodule, including children and adults. However, they are about 4 times more common in people assigned female at birth than people assigned male at birth. They also occur more often in people who live in countries in which food isn't fortified with iodine. Iodine is necessary for your thyroid gland to make hormones. Other factors that lead to an increased risk of thyroid nodules include history of thyroid radiation, family history of thyroid nodules or thyroid cancer, increasing age, iron deficiency anemia, smoking, obesity, metabolic syndrome, alcohol consumption, increased levels of insulin-like growth factor, or uterine fibroids. Most thyroid nodules don't cause symptoms. However, if you have several nodules or large nodules, you may be able to see them. In rare cases, nodules can grow big enough to cause the following symptoms: trouble with swallowing or breathing, hoarseness or voice changes, pain in the front of your neck, or enlargement of your thyroid gland, which is also called a goiter. Hyperfunctioning thyroid nodules can lead to overproduction of thyroid hormones, also known as hyperthyroidism. Symptoms of hyperthyroidism include rapid heartbeat or palpitations, feeling shaky and/or nervous, weight loss, increased appetite, diarrhea and more frequent bowel movements, difficulty sleeping, enlarged thyroid gland, or light or missed menstrual periods. Thyroid nodules may also be associated with low thyroid hormone levels, or hypothyroidism. Symptoms of hypothyroidism include fatigue, numbness and tingling in your hands, weight gain, dry, coarse skin and hair, constipation, depression, frequent and heavy menstrual periods. Researchers don't know why these thyroid nodules form. Nodules can form for various reasons, and there are different types, including colloid nodules. These are one or more overgrowths of normal thyroid tissue. These growths are not cancer. They may grow large, but they don't spread beyond your thyroid gland. These are the most common type of thyroid nodules. There's also thyroid cysts. These are growths that are filled with fluid or are partly solid and partly filled with fluid. Cystic nodules pose a low risk for cancer or malignancy and are either monitored or biopsied if they are larger than 2 centimeters. There are also inflammatory nodules. These nodules develop as a result of long-term or chronic swelling or inflammation of your thyroid gland. These growths may or may not cause pain. There's also a multinodular goiter. Sometimes an enlarged thyroid or goiter is made up of many nodules, which are usually benign. Hyperfunctioning thyroid nodules. These nodules produce extra thyroid hormone, which may lead to the development of hyperthyroidism. Hyperthyroidism requires treatment. Or thyroid cancer. Cancer is the biggest concern when thyroid nodules form. Fortunately, thyroid cancer is very rare. It's found in less than 6.5% of all thyroid nodule patients. There are a few articles linking the possibility of thyroid conditions to vaccine side effects. According to an NIH study conducted in 2002 regarding the anthrax vaccine side effects, titled "The Anthrax Vaccine, Is It Safe? Does It Work?" is quite a large document with many findings, one of which found significantly elevated adjusted rate ratios in the cohort that received 4 or more doses, which included malignant neoplasms of the thyroid gland. Of analysis of the data concluded the committee emphasizes that the statistically significant associations observed are not necessarily causal associations, and indeed, most likely are not causal associations. Although there is not any sooner anthrax vaccine research showing the accurate side effects of the anthrax vaccine absorbed vaccination protocol, there is evidence of the correlation between thyroid dysfunction and the COVID-19 protocol. According to an NIH study conducted March 2022, titled "Thyroid Dysfunction Following Vaccination with COVID-19 Vaccines, a Basic Review of the Preliminary Evidence," 83 reported cases included in this review. The most cases of thyroid abnormalities were observed after vaccination with the mRNA-based vaccines, followed by the viral vector vaccines. Subacute thyroiditis was the most common COVID-19 vaccination-related thyroid disease, accounting for 60% of all cases, followed by Graves' disease. Fortunately, almost all cases with COVID-19 vaccination-associated thyroid dysfunctions had a favorable outcome following therapy, which is why it is so important to understand the side effects of vaccines so we can monitor the patient and treat those medical conditions in a timely and effective manner. One of many reasons why we need vaccine injury research concerning the side effects of each military and civilian vaccine given. Operation Truth is conducting a series to show our fellow chronic multi-symptom illness patients how to conduct your own root cause analysis.